Hello, everybody. This is Sal again. I've been asked a few questions about do not resuscitate orders. So I put together this little PowerPoint about frequently asked questions. I hope you enjoy it and hope this clarifies some questions that have been asked. So what does DNR mean? The abbreviation DNR stands for do not resuscitate, which is a medical directive that means to not bring someone back to life or consciousness in the event that they become unresponsive. Signing a DNR means that you don't want doctors or emergency personnel to perform CPR if you stop breathing or your heart stops beating. So why would somebody get a DNR? A DNR order is allowed for any reason. Any adult can request a DNR, including healthy adults. People most likely to use them are those who know in advance that their chance of surviving CPR is very low and or they don't want to spend their last days on life support. To the right here, I have an example of what a DNR looks like. You need to make sure that every single bit of information is filled out on here, checked, crossed T's, dotted I's. So DNR, a do not resuscitate order is a legal order signed by a physician that specifies you do not want to be resuscitated in an emergency. DNR orders are more common among people whose chance of surviving resuscitation is very low. So what is the criteria for a DNR? A DNR decision may be taken when there is a risk of the patient's breathing or heart stopping. If it is decided not to resuscitate, CPR will not be attempted. This is sometimes called a DNR order. It is important to note that even if a DNR order is made, this should not affect other treatment decisions. So what makes a DNR invalid? A DNR order may be invalidated if the immediate cause of a respiratory or cardiac arrest is related to trauma or mechanical airway obstruction. So can you give oxygen to a DNR patient? A DNR order does not mean that no medical assistance will be given. For example, emergency care and other healthcare providers may continue to administer oxygen therapy, control bleeding, position for comfort, and provide pain medication and emotional support. How long do DNRs last? Your DNR orders are in place for as long as you wish them to be. You need only to destroy them if you wish to stop them. You should also contact your doctor's office and family if you do so. So if a family member asks for their deceased member to be brought to a location other than protocol, what is the course of action? Well, this should be handled between the family member or members and the coroner. But we also want to advise our supervisory of what is taking place. So do we need to have the DNR physically or digitally? There's no digital and no verbalization. DNR orders must be written by medical professionals rather than verbalized. Written DNR orders must include the patient's name. DNR orders must be dated, and the DNR order must be signed by the healthcare provider. Can a family member refuse a DNR order? If a person has already completed a DNR order, their family cannot refuse the order. If you have a DNR order and your family members disagree, medical personnel will still honor your wishes, but the medical staff will communicate with your family to try to get everyone on the same page with your decision. Over here, I have a purple wristband, of course, that shows DNR. So the DNR wristband in 2008, the American Hospital Association, AHA, asked all U.S. hospitals to consider standardizing the color of their patient hospital wristbands as an improved safety measure with these specific meanings. Purple to denote a patient's do not resuscitate or DNR status. Following this PowerPoint presentation I did for you, I have a video here. The title of it is Georgia Nursing Homes and Senior Care Facilities and Improper Do Not Resuscitate Orders. Please take the time to listen to this video. It's pretty interesting, some of the stuff that has gone on with nursing home around Georgia. I hope this short presentation answered some of the questions that were asked about DNRs. I know it could be a sticky situation. Also remember, we also have DNIs, which are do not intubate. If somebody says they have a DNR but they can't find it, well, you got to do what you have to do until they present yourself with that piece of paper that shows the DNR. Again, anytime you need me, this is Sal. You have a safe day. Bye-bye.